Yes, sickle cell has come a long way in terms of treatment. I think about back to 1989 when I was first diagnosed. I was diagnosed at 18 months old. So they weren't testing babies to see if they even had sickle cell. My parents just knew that I was a child who was screaming because I had a fever and they didn't know what was going on. So they took me to the emergency room, and after all this testing, they found out A, my spleen was about to rupture, and B, I was diagnosed with sickle cell disease. So, in terms of that, we've come a long way. And in terms of the treatment, traditionally, we used to focus on pain control versus now we're focusing on prevention of these crises. So back in the day, the only treatments that were out there were really hydroxyurea. And to this day, I still take folic acid every day because I don't qualify for hydroxyurea since I don't have sickle cell crises as often. But now we have drugs like Oxbryta, Endari, and Adegveo, which are groundbreaking because their clinical trials have proven that they are helping to form healthier red blood cells, preventing further damage to already existing red blood cells, as well as minimizing occlusions due to platelet aggregation, which therefore slows the frequency and minimizes the number of vaso-occlusive crises a patient may have, as well as minimizing those complications that result from the crises. I'm also excited about many qualifying sickle cell patients who are able to be cured because of stem cell transplant. So there's been a lot of things going on in the sickle cell community, especially since I've even graduated pharmacy school, because I remember in pharmacy school and we only talked about pain control, hydroxyurea, and the role of folic acid. I don't remember my lecture including these new drugs that are out. I believe a number of the drugs that I just named, they came out probably in the last 3 to 5 years. So everything is relatively new. And, I'm seeing so many stories on the news about people getting cured. It's so wonderful.